This is another big one that I see a lot. Cryo and it being the cause of permanent numbness. Is it really the cryo? What else can contribute?
That is my favorite question. Actually, that's my biggest beef when I read online. People are like, "Oh, don't get cryo. I have permanent numbness from it." So people have been numb from surgery long before cryo ever came in. When we do surgery, we're making an incision, we're lifting the muscle up, I'm shoving my big hand under there, I'm running bars, I'm putting ties. We do nerve damage. Every surgeon, every procedure that's done, there's damaged nerves. There's no way to do a surgery without damaging nerves. You have thousands of microscopic nerves growing from your chest wall out into your skin, innervating your skin. And so when we go under there, we plow through them. Those nerves are supposed to grow back, they're supposed to reconnect, but you have these big metal bands blocking their pathway. You have a lot of inflammation. Sometimes there's fluid underneath the pockets. There's all these things that prevent nerves from reconnecting and healing normally. When you do cryo, you're just freezing the main nerve that runs between the rib. And the way cryo works is it basically freezes and degenerates the very outside sheath of a nerve. And so a nerve is like wire. You have like the outside, covering of the wire, and then you have all the wires in between. And so the stuff in between is still there. So it's just a matter of rehealing that sheath. For most people, that is, starts at about 4 to 6 weeks that the nerve can start coming back. Some people it takes longer, but you shouldn't have permanent numbness from cryo if cryo is done right. And when I say when cryo is done right, what does that mean? Well, when you freeze a nerve, it looks like a little pen. It's got like a ball on the end, and you put that ball on the nerve, and it creates like an ice crystal. You have to wait until the probe is done and starts defrosting to take it off. Because if you crack and break it off, you're going to screw up that nerve. And so there are technical things when cryo's done right, you should not have permanent numbness. Now you can get a little bit of kind of, I describe it pissed off nerves when they come back, where people will have some burning and some other sensations that are kind of funky. They'll feel like their skin's sunburned and stuff. That can happen from the cryo as those nerves come back. And gabapentin or Lyrica work really well to, help kind of calm down those symptoms until the nerves, get back completely. But yeah, cryo should not cause permanent numbness. But surgeons do cause permanent numbness, unfortunately. And the more bars you have, the higher that risk is because it's just, a bigger area. And so surgeons that do one bar, don't do ties, don't do links and all that other stuff, they probably don't have near as much numbness as someone like me, but they also don't get a repair that's as good.